Hi, I'm Lucy Ellis and I'm here at BioEurope Spring in Barcelona, and I'm joined by Marcus William, CEO and co-founder of MowoOT, a med device company that's just won second place at BioEurope Spring's Healthtech Startup competition for their new device that's a chronic constipation product already on the market in Spain. So thank you for joining me here.
Thank you for having me.
Maybe to start, you could talk a bit about how big an issue chronic constipation is.
Yeah, basically we detected this big unmet clinical need in a hospital for neurorehabilitation, where mainly the patients were people with spinal cord injury or neurogenic diseases like multiple sclerosis or Parkinson. And up to 80% of these people suffer from chronic constipation. It's a difference to the general constipation that a healthy person has, you know. So they need solutions that they can use every day, and they don't have side effects. But apart from these people, up to 15% of the general population also suffer from chronic constipation. If we are taking the markets of Europe and the United States, we're talking about 150 million people.
So what's your product and how does that work?
Our product is a non-pharmacological, non-invasive solution without the side effects of laxatives or other invasive solutions. It is based on the manual abdominal massage that professional therapists do in neurorehabilitation centers. So basically it's a really lightweight belt that is connected to a desktop device that generates an algorithm that we developed together with a neurorehabilitation hospital here from Spain. Yeah. And the massage is administered with using air cushions. That means there's no side effects like due to electrical stimulation, etc.
Okay, and you're already launched in Spain, so what are your plans for launching elsewhere?
So actually we launched in Spain last year to kind of like a proof of business. And this year our plans are to enter different European markets. We already have confirmed different distributors, for example Germany, Austria and Switzerland, and we're actively looking for distributors in the UK and Netherlands right now.
And what's the time frame on those kind of launches?
So UK and Netherlands, we should enter these markets this year. We are thinking that we will conquer the rest of Europe next year, and by the end of 2018 we want to enter the US-American market, which is I think the most interesting market for our product.
And why do you think that's the most interesting?
You know, here in Spain there's not a lot of reimbursement for medical products right now, but the people in general, they are used to that the social security is paying for what they need for health. In the USA, the market is completely different. People are used to that they need to buy things themselves, so that's an easier market entry than because the procedures of getting reimbursement, official, etc., take a lot of time.
Yeah. And is there anything you've learned from launching in Spain that you might apply to other places?
Yes, of course. The biggest key learning was that. I think it was obvious, but we had to learn it, we had to see it, that our patients are chronic patients. Yeah. So if you talk to them, they say it's 20, 30 years that they have this problem, and I have tried everything out there. Why is your product different? So what we learned is that we really need, we are focusing on each customer segment. We have one testimonial of a representative person on our website, so this creates trust in our solution. We implemented kind of like a money-back guarantee. If it doesn't work for you, no problem, send it back, because we're so convinced that it's a great solution and it helps these people once they overcome their initial skepticism.
And will you be able to use those tools elsewhere, or the feedback that you've got in your other launch?
Yes, I think definitely clinically we showed with studies already that it's a really good solution, but it's a challenge to get sales up. And I think what we just learned for marketing and communication of our device in general will help us with all European or US markets.
And who are your competitors then in this space?
As I said, there are really no direct competitors, because chronic constipation is different to constipation. The products you might see on television are laxatives. That might be pharmacological to herbal, but they still they have side effects and should not be used daily in big quantities. And on the other hand, there are invasive products like enemas or even intestinal pacemakers that obviously have side effects and should not be used daily. So our big business opportunity is the non-pharmacological, non-invasive approach. We don't have the side effects of our indirect competitors, yeah. And the feedback so far from our clients has been great. It's a life changer according to them.
And do you think that's why you've managed to win this second place prize at BioEurope?
Yes, I think it's. The market is huge and the suffering is big, and especially because it's a problem that's really. We're talking about going to the toilet, you know. It's the problem is really something personal. Sometimes even the medical doctors don't know it. Our allies in communication are, for example, nurses and physiotherapists that have daily contact with the patients, and there's more of a conspiracy. You talk to them about personal stuff.
Yeah. And what else brought you to Bio Spring then this time around?
So obviously this is a great event for networking. We are fundraising, and part of the pitch we did was we were communicating our second investment round. We just won public funding in form of a Horizon 2020 SME instrument funding, which basically pays for everything except for marketing. And as I just explained, the marketing is the big challenge for us, so we want to raise some money for marketing. And I made some great contacts here. I'm really happy I came.
Brilliant. Well, great to talk to you, and congratulations.
Thank you very much.
Thank you.